A new controversial bill regarding birth control has been advanced in Arizona, which would allow employers to fire women who take the pill to prevent pregnancy, rather than for health purposes based on religious and moral beliefs. Current U.S. law states that birth control is covered under health insurance plans for women in Arizona for contraceptive purposes as well as health concerns.
We believe some of these things that would be allowed, that they've kind of redefined into contraception, really are abortive in nature, and we simply can't stand by. We certainly shouldn't be asked to pay for that, and that's what this legislation, this directive would require us to do.
However, the new Arizona birth control bill, House Bill 2625, states that women who want their birth control to be covered by their insurance plans must verify its purpose to be solely for medical reasons and not to prevent pregnancy. The bill would allow employers to deny female employees the right to be covered based on religious beliefs.
It's absolute hogwash. It's that simple. You can't be an employer of millions of people and decide that you're going to offer substandard health care. It just doesn't work that way. The Catholic Church and its affiliated organizations employ millions and millions of people. Those people aren't necessarily even Catholic.
The new bill was passed by Arizona's House of Representatives in early March and was endorsed by the Senate Judiciary Committee on Monday. According to Arizona House Bill 2625, employers can refuse coverage for birth control for contraceptive, abortion, or sterilization purposes, forcing women to submit a claim to prove medical conditions which require treatment for birth control.
I think that it's pretty surprising that any elderly or even middle-aged man would be in control of women's rights, and especially birth control that affects women's reproductive and it's like basically reproductive future. So I think on behalf of not only women but also of minorities, it's really important that we are educated and understand the issues at large before we trust people that aren't women's health experts to decide of what our birth control should be right now and in the future.
That I think all women need access to contraceptive care, health care, all those things, and I think then what is incumbent upon every person is to apply their own religious values to that structure. So because the structure is available doesn't mean people have to avail themselves of it, but I really believe that it's imperative that we have those things available for everyone to take advantage of.
The bill would force employees to show their employers their medical records and also grant employers the right to deny health insurance coverage, forcing women to pay full price for their prescriptions. The American Civil Liberties Union has started a petition against the Arizona House bill, saying it is discriminatory and must be abolished. This is Julia Telfer with IB Times TV.